I'm Dr. Anthony Maloof of Eyes and Faces in Corneal and Oculoplastic Surgery, and welcome to this video on two not uncommon problems that happen that patients present and complain of after cosmetic surgery of the lower lid. Firstly, what do I mean by cosmetic surgery? Cosmetic surgery is surgery to change your appearance, okay, from your natural state. And you're doing it for the aim of improvement of appearance rather than function. That's cosmetic surgery. So the most common reason people do this of their lower lid is because they don't like it. The bulges that appear, or the fact that the lower eyelid may look droopy and make you look old. So that's why people have the surgery. And then afterwards, they often complain of dissatisfaction. The first most common cause of dissatisfaction is the corner of the eye doesn't look right. It could look like a whole host of different descriptions, but in the end, the patient just says, it doesn't look right, it's not me. And that happens because the corner of the eye is pulled down or pulled inwards, or it's distorted. There are many different reasons why. It can happen due to poor surgical design. It can happen due to factors involving your tissue or wound healing. But in the end, it doesn't look right. It can be fixed. So that is the first one. We call that rounding of the canthus or blunting of the canthus. Please remember there are many different causes of this problem. They're not all the same problem, and therefore the treatments are not all the same, and different approaches to surgery may be required. You'll see here a lady who's had surgery and she's had rounding of the canthus. She actually had 2 procedures, and so I've had to go back in. I didn't do the procedures. I've had to go back in and repair it. And the aim is to lift it up and we'll give it a lovely V angle, and you'll see afterwards at 6 weeks she's got that. Much more comfortable, and it looks aesthetically pleasing. That's rounding of the canthus. The second problem that people complain of occurs much later after surgery, so much later that they often don't even associate it with the surgery. And this is called eyelid retraction. And what it means is the eyelid goes down. It's a problem with the lower eyelid. So initially after your lower eyelid cosmetic surgery, you'll think, that's really great. It looks so much better than it did before. And over the next year, the lid just slowly drops down and the eyes become uncomfortable and sore, and you get told you've got dry eye. You don't, you've got exposure. You've got exposure because the lid drops down and it doesn't move properly. Now, unfortunately, that's much more difficult to treat, and it requires lifting the whole mid-face and correcting it. But it can be done and give you much symptomatic relief as well as look better. So that can happen a year to 10 years after lower lid cosmetic surgery. It is really disheartening to patients, and it's often associated with poor blink function. So you actually don't blink and the eyes open wider, and that's called eyelid retraction. Here you'll see a lady who presented with bilateral, so both sides eyelid retraction, and she's got discomfort. And so we'll be elevating that to correct it for her. Unfortunately, we do it one at a time, so there is a delay period involved in the recovery. Well, I hope that all makes sense. Rounding of the canthus, eyelid retraction, 2 very unpleasant adverse outcomes from lower lid cosmetic surgery. I'm Dr. Anthony Maloof. Thanks for watching, and as always, look into the channel for hopefully some updates that you might find interesting.